So you seem a little DETD. That's what we call it, down in the dumps.
No, I'm not down in the dump. I'm a bit aggravated. Like back in the day, I remember when I was first in medical school, so 1976, 1977, there would be these articles in the newspaper, or you'd be on like ABC News, sales rep in the operating room. And it was like a shock, like at that time, that
they were in the OR.
operating room telling the doctor what to do. It was like unbelievably controversial at the time. Well, that has evolved because there's so many complex things that go on in an operating room. It doesn't matter whether it's a spine operating room, an orthopedic joint replacement operating room for vascular surgery. There's always a company rep. If you're going to use an implant or certain instruments, there's almost always a company representative there. And you get to rely on them. You know, they have to bring their stuff in. They have to make sure that their trays they're sterile. They've got a backup tray in case something's missing or something breaks. We have a patient tomorrow who was going to have a disc replacement. They have a 2-level disc replacement. So a lot goes into scheduling this stuff. So now I got to coordinate Dr. Pell's schedule, my schedule, Mel, the hospital, and then the instrument people.
And there's things that the patient has to do
and then
to
the
get
patient,
ready too.
the patient has to get ready. Our normal rep who services us is out of town, so one of his associates supposed to do it. Well, everything just fell right through the roof. Like, we don't have a backup set. I don't know if it's going to be there on time. So, we cannot legitimately ask this patient to come to the hospital when we don't have the stuff we need. And we're really dependent on these people. And they do, they make quite a bit of money.
They ain't hurting.
Trust. They do very, very well. In fact, some of them.
You got to know why healthcare is expensive.
Some of them do as good or better than the doctors. And I don't begrudge them, but just be there with the stuff.
Yeah.
It's a big deal. It's unprofessional. It's inappropriate. They knew this case had been on the books for well over a month, and there's just absolutely no excuse for it. I'm not going to let it go.
Yeah.
Let's put it that way. Not that I want somebody's head, but there's other competitors that can supply, but not that I want somebody's head. But something that it's really, really inappropriate and unprofessional at minimum. So yes. And it's a long life, and I'm not going to forget this. So